So I want to say thanks to all the doctor who was caring of my daughter, and special to Dr. Ang, because he is the one who was, like, how to say, who was more care, no? And he loved my daughter like his daughter. He's always saying, she's my baby, she's my baby. So you can see now big difference between before and now. Before she was like, really we was thinking that she will die. Because now after treatment she got 6 months chemotherapy, and now she got bone marrow transplant. The tumor is finished all, no more tumor, and the lung is come back to same site, and so now she can play, she can run, and she can everything, not like before. Before she cannot move and she cannot breathe. So treatment and anything, if we want, we can call the doctor and they will, how you say, prepare any medicine and any care, any small, like small things, anything happen, like I know that it will be covered.
They can care.
Yeah, they will care. Then nurses is very nice also, is very friendly, and they're caring so much, and so they will not have any problem. We are very happy here and want to say thanks for everybody. And
I was called to see baby Fatma when she was already intubated and in intensive care. She was very ill. She was already on a respirator. From the medical records, it was quite clear that she was diagnosed to have this massive cancer recurrence in the left chest. And she could not breathe. She was gasping for breath. As a result, the doctors in UAE had no choice but to intubate her and support her on a respirator. She was then air evacuated all the way from the Middle East to Singapore. When I saw her, it was a really pathetic sight. I mean, to see a girl so young, and just barely a baby, and suffering from such terrible illness. We immediately reviewed the records. This patient has been extensively treated before in the past. She has had her kidney removed. She has had chemotherapy before. But unfortunately, the treatment was not effective, and she now had a cancer recurrence. And this was not a small cancer recurrence. Let me show you on my computer. You can see this is a computer scan of the chest. And this computer scan was done in August of 2006. This is the heart. The heart is supposed to be in the center, but in this particular case, the heart has been pushed all the way to the right side. There's a very, very large tumor that fills the entire left chest cavity. And because the heart is pushed across, the lung on the other side is completely squashed. We did a minor operation and just to get a biopsy to confirm the diagnosis. And this was confirmed to be a Wilms tumor, a fairly common cancer in children. But because the tumor was so large and it was bleeding very, very massively, each day we had to transfuse her many packets of blood because she was bleeding actively from the chest tube that was inserted. We explained to the mother that this was a do or die. There were two options. One was simply to throw our hands in the air and to say, look, there's nothing more we can do, just to minimize her suffering and let her pass away peacefully. The other option was a very aggressive option, and that is to offer her chemotherapy despite the fact that she was already on a respirator or in respiratory failure. After extensive discussion of the pros and cons, the mother and the father accepted our proposal and started her on chemotherapy. Really, we were all scared. We were praying for her that she would have a good response. And let me show you the results. This is a CT scan that is done in November of 2006. So the original scan that you saw was in August, and this is in November. You can see the heart is no longer pushed over to one side, but instead has gone back into the center position where it should be. The lung has expanded, and you can see the tumor has shrunken significantly, probably by about 70%. And because the tumor had shrunken nicely, we were now in a position to surgically go in and remove it in its entirety. The surgeon was very surprised. The difference between his first operation, when he could open a tiny hole just to take a peek, and the second operation when he could clear the whole mass en bloc. This child is now doing well. This is baby Fatma. While undergoing treatment, you can see, she's in the pink of health in comparison to the original picture when she was on a respirator. She's doing very well, okay? And baby Fatma has just undergone high-dose chemotherapy with stem cell rescue and is making good recovery. We've explained to the parents that while we are certainly pleased with the response that we have up to this point, there is no guarantee that the child will be cured. We need to wait for at least a year or two. If indeed she's able to remain disease-free for 2 years, only then will we be able to say that she's cured of her cancer.